So quite often I'm asked to see patients with male factor infertility. One of the most important things is actually making that diagnosis in the first place. Quite often when a couple are trying to conceive, a woman is normally investigated fairly well. The investigations are fairly prompt and comprehensive, and it's only really normally when those investigations come back as normal that the attention then turns to the male patient. It's at that stage when, if there is any abnormality in the semen analysis, in the hormonal blood tests, or indeed the patient describes any symptoms of sexual dysfunction, that the patient ends up getting a specialist review. So what about the potential diagnoses that male patients are given? A lot of the time there's considerable jargon, and that can actually confuse people. So let's just go through a few of the common things that we see. Azoospermia. Azoospermia is quite simply the lack of sperm in a man's ejaculate. So they've done a semen analysis and unfortunately this has shown no sperm at all. This isn't something that can be picked up by the naked eye. Quite often a man will tell us they're able to orgasm and ejaculate without any problem whatsoever. It looks normal to them, and it's only really when it's analysed in a laboratory that they find out that there's no sperm. The other possibility when doing a semen analysis is oligospermia. So what's oligospermia? Oligospermia is defined as a sperm density of less than 15 million per mil. What does that really mean? It basically means that there's too few sperm in the ejaculate, and there's different levels of severity of this. So it can be very low indeed, normally less than 5 or even 2 million per mil, or low, which basically means less than 15, but not drastically low. So perhaps 10, 11, 12, nearly at the normal limit, but that would still be described as an abnormal reading.